Welcome back to the Fit Minute Podcast, fitness for real people, with your host, Gabriel Mazar. Gabriel interviews Dr. Ben Leong of Rehab Lab, Arizona. As a doctor of chiropractic, Dr. Ben specializes in movement and injury rehab and prevention. From his own rehab process and the struggle that came along with it, he fell in love with chiropractic and knew from a young age that was the path he wanted to pursue. And now here's your host, personal trainer and stretch therapist, Gabriel Mazar.
Welcome back to the Fit Minute Podcast, Fitness for Real People. I'm your host, Gabby Mazar, and on today's episode, I have Dr. Ben Leong of Rehab Lab, Arizona. Welcome to the show today.
Yeah, thanks for having me on. Excited to be here.
Yes, I'm so excited to talk about your business today because you are here local with us in Tempe, and you being a chiropractor and also having a lot to do with movement, we share a lot of things in common. So I'm super excited to talk about you and your business today. So why don't you go ahead and tell us a little bit about you and your background and how you became a chiropractor?
Yeah, so my wife and I, we just moved from New York City. So we're really happy to get out of that kind of busyness there and everything that, just has been going on lately. And so we're happy to be out here in Arizona now. So the way that I got into chiropractic, and I think this is what a lot of people who do any sort of health work, they get into it because they're their own like patient zero. So my injury history is very significant. I was a football player, and in high school I tore my ACL basically every year that I played. So just like back to back, freshman, sophomore, junior year of high school. And in that experience, learning, how do I, deal with kind of losing something that I love so much and then building that back or putting that all back together for myself, I actually started to enjoy that process and enjoy the rehab and enjoy, just building things back up again. And so I knew in high school already that that's what I wanted to do with my life, was to help people overcome the injuries that they have, whatever obstacle that is, whether that be, a serious injury or something just like a minor strain that they're dealing with, or, an emotional or a mental obstacle. But to be able to take those things and in my own personal life where I've said, okay, I've learned how to develop ownership over this, learned how to heal myself emotionally and physically. And then now I can take that back and, be better than I was before. And so really in my own rehab process, the struggle of that and then getting better and then finding, what it is to have conquered something. That's really where I fell in love with the idea of Rehab Lab and the chiropractic work that I do.
Yeah, it's interesting because I think especially when we're younger and we hurt ourselves, even not just in high school, but as we get a little bit older and after high school, but are still younger, we don't realize the repercussions that we have from just even a smaller injury like twisting your ankle or, tweaking your shoulder or hurting your back. I played volleyball, so I have now at almost 40 years old, I'm starting to develop arthritis in my fingers, in my fingers, because I was a setter. So little things like that you don't really think are going to happen to you. You don't know that they're going to happen to you. So it's really important to understand your body, how your body reacts to things, and how you can rehab or how you can treat your body to handle those things or to recover from those things. So chiropractic is a great way to do that, along with other forms of exercise, which you also help with as well. So you came out here from New York and have a facility out here. Tell us a little bit about your facility here in Tempe.
Yeah, so I'm inside of a gym called Retraining, and so I have one of their rooms there, and it's on Southern near Tempe. So that space, I'm like pretty proud of it, just to have my own space. And out in New York City, I had my own space, but I was working under somebody, and I was inside of a Pilates studio. And that was a lot of fun because there was all this back and forth of working with those trainers. And I think I've grown like so much admiration for like anybody who's doing Pilates or anybody who's training Pilates, just because of the intelligent language and the intelligent way of thinking and processing things. And so seeing that has been really cool. And I've translated some of that into like my own, the way that I work with people and that kind of stuff. But just as far as the space that I'm in now, it's great because I have a gym floor that I can go out to. So when I work with people and I create a body map, right? So injury history is really important, just like you're talking about. I don't know how many times you have somebody fill out a form, they hop on the table and they're like, oh yeah, my knee's bothering me. this or that, right? And you go through and you're checking and you check the ankle and you're like, hey, what's going on here? There's so much dysfunction here. And they're like, oh yeah, I fractured my ankle, but that was 10 years ago, right? So that doesn't necessarily matter. And you say,
Or,
no,
I had two vertebrae fused
exactly,
10 years, 5 years ago. And it's like, why wouldn't you put that on there? What?
Right. It's like, no, this is extremely relevant to what's happening in your body, how your body's absorbing force, how, and how that translates to the knee. That's the current problem. And so being able to do that with people is really good on the table. And then we do soft tissue work. We do our adjusting, cupping, whatever we need to do. And then we take them out to the floor and we get to do exercise. And that's really where we get to combine everything all together. So it's more holistic. So just like what you're doing at Pilates Tempe, where, you have so many different ways of working with people, so many different versatile avenues for people to grow and develop. That's also what I'm trying to do in my space as well.
Yeah, there's a lot to be said for, like we were just talking about before this, is you want to have a well-rounded way of treating people, because there's no one size fits all. There's no one program that works for everybody. So you have to be able to work with people's different biomechanics, people's different bodies and how they function, because an injury isn't the same. A twisted ankle for one person isn't a twisted ankle for another person, because they may walk differently. Their gait is different, or their posture is different, or they've injured their ankle 4 times instead of 1 time. So it's different for every single person. So you have to treat that for each individual person and treat it differently with maybe similar exercises, but kind of in a different manner for each person, which is, I think, kind of the fun of what we do and how we meet each person and look at the person. And even with fascial stretch therapy, which what I do is, people always say, how do you know when to stop? And it's like, well, you feel it. You feel the movement of your body, and when your body's telling me, no, okay, I can't go anymore. And then you can go a little bit more without pain, right? So when you're working on someone's body, you know what it's supposed to feel like. And then say you're working on somebody's ankle and it's blah, 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 all over the place. You're like, no, that's not right. So, it's just that fun feeling of knowing that you're helping somebody and treating people each individually with each individual ailment or whatever they want to be fixed or take care of. Most of what we do is, a lot of people come to us because they want core strength, because that's what Pilates is really known for. But so with your specialty and with what you do, can you tell me a couple of stories for people, particularly kind of like amazing stories of people that you've worked with? Like, I guess not before and afters, but just how you've helped people, specific clients.
Yeah. So some of the more interesting or fun clients to talk about are the ones that have those, like, you get them on the table, you discover something about their history that they didn't want to address, or they didn't think was relevant. And so I've had a patient who had appendicitis, and that scar tissue that they had in that area was shutting down the way that their hips worked. And it was relevant because they had low back pain and they had knee problems. And so for me, when I look at the body, right, I want to find, okay, what along the chain is dysfunctional? What is not absorbing force the way that it needs to? And for this person, when we went through and we worked on that scar, that started to open up a lot of their motion and help them learn how to breathe normally. But that was just like, for them, they started crying, like all this stuff, to be able to finally say, oh, okay, now I can feel what it's like for my quad to work. I can feel what it's like for me to be able to use my glute, because my psoas is not condensed, also tight because of all that scar tissue. So just by even just like neurologically stimulating that area and getting that to open up where the appendicitis scar was, for them, that was a really powerful thing. So,
and who would have ever thought?
Yeah, who would have ever thought, right? And they would have, you don't
never
even
considered that at all, right?
Yeah, but so in my own history, or in a lot of people that come in, scars are so fascinating because of the way that they disrupt the tissue. And so one thing that we'll work on post-surgery is, hey, how do you get this scar? How do you get the sensation back? Because everybody has that, the way that tissue lays down, it's all cross-fibered, crooked and everything like that. And then you just need to stimulate the tissue. And at the beginning for people, that's really like a prickle or a pain. And then over time, it starts to normalize. And when that tissue normalizes, then your brain can say, oh, okay, I can move through this space the way that I used to move through that space. And so restoring people to the way, not just, oh, this joint meets the criteria that it's supposed to meet, but your mind thinks of the joint that way, right? Your mind understands where it is in space. That's really important. And so clients where I get to do that with, they're the most fun because that's where you see the most drastic differences. That would be my kind of main thing that I enjoy doing with people.
I think one of a recent client I just worked with, she tore her glute, I think it was the glute med, off of her lesser trochanter, and completely tore the glute muscle off of the bone. So it's like her butt was sagging down.
Yeah.
And, she went to a couple different doctors and they told her, sorry, you're out of luck. We can't do anything about it. And she's like, I'm not, she's still, in her 50s. She's like, no, I'm too young for this. I'm not, no way. Playing pickleball, by the way, which is the new craze. So everyone playing pickleball, beware. Okay. Beware of your butt. But so she is just about a year out and she's still having issues with it. She did have it reattached, and she is now back to doing Pilates, and she comes twice a week, and it's been a process. It is, that is a process, because reattaching that is no small feat. But that's kind of an interesting one to me, because getting that muscle to fire again is tough, because it's completely ripped, completely torn off. But those are kind of the fun ones to me, where you hear stories all the time when people come to you and they're like, oh, this happened. You're like, what? How does something like that happen? But I love seeing people. I had a client who was a stretch client years ago, and she had really shortened Achilles tendons. And so they had done surgery to cut the tendons to elongate them. And still, when she walked, was on her tippy toes. And, she would walk kind of with her knees pointed in and walk on her toes. And I would stretch her, and it was tough. This was kind of earlier in my career, and I would stretch her, and an hour-long stretch, and I would really focus just on the lower body. And when she walked off of my table, she was walking straight. Yeah. And that, as time went by, they tightened back up because they were tight. That's something you would just have to continue to do all the time. But those are stories where you're like, this is why I do what I do, because you are helping those people to walk again, to, be able to move again. Having an entire muscle torn off of the bone is intense.
Yes. Yeah. No, definitely. Yeah, I think, so to go along with what you're saying, there's some times where you get somebody and you work with them, and it's like 1 or 2 sessions and they're good, right? And you just unlock something. It's a quick fix, right? And then there are other times, especially when you're working with fascia or tissue that's scarred, where it takes a long period of time. But just the idea of, you can be what you used to be, you can do what you used to do, and restore those things, just to be able to get people back to that place, I think is so valuable. So just in my own life, after all the ACL surgeries and everything like that, I was never able to do a full deep squat, or even to kneel and just sit. People think about meditation is so valuable, all those positions that you get in where you're able to kneel and things like that. I couldn't do it, but I was able to play football, college football, that kind of stuff. But then afterwards, I was like, yeah, I got to figure this out, right? And so in school, I started to just say, well, how do I start this? And just 5 minutes a day kneeling, 5 minutes a day of squatting. That's when the tissue starts to adapt. That's when the fascia says, okay, I'm going to surrender to the demand that you're putting on me, the load that you're putting on me. And I think, there's that kind of duality of, okay, some things are easy, right? And those are fun and those are cool. But the things that your body adapts to, and the way that you can change things over time, that opens up things you can do almost anything that you teach your body to do. It's just about, how do I train? Can I be consistent? All of that kind of focus.
Well, it's funny you say that because we train our bodies to do one thing throughout our life. Then
Yeah.
what we're really doing is untraining our bodies to do something. So
Yes.
we're retraining, not untraining, I guess, retraining to
Yes.
do something else. So, we have our habits, the way we walk, the way we sit, the way we hunch over, and then you're just retraining your body to do something else. But you are 100% right. You can train your body to really do just about anything. So speaking of training, you do like a fascial training. Can you explain? I mean, I know what fascia is, but can you explain what fascia is and what fascial training is?
Yeah. So fascia is the connective tissue that runs throughout your entire body, and so it like connects organs together. It connects muscle tissue together, and it's really critical because it's like a sleeve or a web around all of the fibers of your tissue. And so where you have dysfunction or you have tension in one part of the chain can cause dysfunction somewhere else downstream or upstream. And so when we're talking about doing fascial training, a lot of that focus is to say, I don't want to think so much about, oh, this exercise works this muscle. This exercise is for that muscle, right? I want to think, what is the pattern that I'm able to create? How can I find length along this chain that helps me unlock something else down here? And so that's ultimately what we're trying to do with the fascial training. I have an online training program that we're building out. It's called Movement Code. And that program, we're taking a few pro athletes that we're starting with, and we're getting them to work connectivity into their feet so that they have better translation of power into the lower extremity. So when we're talking about sports in general, a lot of sports are ground up. And so just in general, in society with shoes and all that kind of stuff, there's an overall neglect of feet. And so that's what we're trying to kind of lock into. Your foot is your first point of contact for everything that you do for most people. And so how are we going to get that to reawaken? And that's going to, that when you start getting better innervation through the foot, when you start getting better strength through the foot, then that changes the way that your body absorbs force everywhere else. So that's kind of the baseline of what we're building at Movement Code.
Well, I think you can see that too when you work with somebody. I'm sure you do this all the time. When you are stretching something or moving something, let's say you're stretching the glute muscle and they feel it in their shoulder
Yeah.
or on the opposite hip flexor or, their ankle. It's like, wow, I really feel that in my ankle. Well, yes, everything is connected. When you have a tightness here, it doesn't necessarily mean that there is something wrong here. It means possibly you have something wrong in your foot. And you're absolutely right. Pilates is one of the things I love so much about it is that you use your feet. We do footwork with pretty much every single time you go in to do a Pilates workout, you do and start with footwork because it's so important to get your feet moving, your ankles moving, and start from the ground up. Even though you're not on the ground, you're on a machine, but
Yes.
from the ground up, because you are touching the ground with your feet, and how that absorbs moves all the way up the body. So I do think that is very, very interesting. So tell me a little bit more about what you specifically specialize in or what things you like to work with the most in your business.
Yeah, so I treat the way that I want to be treated, or I treat with things that also have been successful for me in the past.
Sure.
Yeah, but that of course is the golden rule, and so that's how we want people to kind of understand the way that I approach their care. And so in that means for me that means working around my patients and what they like to do. Some people are uncomfortable with different adjustments. Some people prefer certain things. And so we just adapt to whatever it is that they want to do. And so very goals oriented in what we're trying to build. And I think that for me, that's kind of my favorite focus is to say, come in, okay, we've got your injury history. We do all that. What's your goal? What would you do if you had no pain? What would be the thing that you love to do the most? And then we go and we attack and approach that. So it ends up being kind of like when you ask what are my favorite things to do, I definitely enjoy taking people out on the floor, doing exercise. When we get past the phase of discovery, where it's, oh, okay, yeah, I'm able to do most things, and we get into the phase of training, or we get into the phase of jumping or balance work, that's really like fun for me too. So I'd say plyometrics are something that I think is a really fun way to get people to realize, oh, I'm finally getting back to what it was that I used to do. And then balance is something that bridges that gap to plyometrics that I think is critical for everybody in their process back there. So I would say doing the balance work, getting into, okay, how does the foot connect to the eyes? How can I, like, if I close one eye or if I turn my head, right, that changes my vestibular system. And then I have to adapt to a new balance strategy. And then once I get that stability down, then I'm ready to do all sorts of other sports. But this balance connectivity, that's the basis of athleticism.
Yeah.
Yeah.
Yeah, definitely. Balance is super important. I think we definitely neglect it and don't work on it as much as we should. And yeah, it's hard. It's hard. It's a hard thing to work on because nobody wants to work on balance. It's like, it's boring.
Yeah.
But it doesn't have to be. It doesn't have to be.
Yeah, we can make it fun.
You don't have to just stand there and balance on one leg. There's so many things you can do to work on balance that aren't just, one thing. There's so many exercises, so much out there that works on those things. So speaking of goals, because you mentioned goals, what are your goals for you personally and for your business with Rehab Lab?
Yeah, so I mean, we just moved here and we got here in January, and then we had a baby in the middle of February. So I have a 10-week-old daughter, and she's just amazing.
She's very tiny.
Yeah, she is. And so for me, just to be able to, like, say I have a real baby that I get to take care of, and I also have this baby business that I'm learning how to build. Both of those I think I have plenty to do. And so goals for my practice, or goals for what I'm trying to do, is just kind of get to a place where I want to start working with other groups like yourself, Pilates Tempe, and start doing classes where we can do like foot training or balance training, where we can just introduce these concepts to people in the area, in the Tempe area. And then that way, just overall, there's more, for me, connectivity to the community. So ultimately, that's what I'm hoping to do is, meet with other business owners, say, hey, here's, something that I enjoy doing. I'd love to teach a class or teach a course, and then just get going there. But yeah, I mean, generally, the other things that I do, I'm also a football coach for Scottsdale Christian. And so that's another thing that I've enjoyed doing. And there's athletic demands to that I make sure that I have to meet. But yeah, just as far as like being new to Arizona and learning, what is it like to be in the desert, and what is the summer really going to be like? I think that's all very exciting. So are you native here, or are you from here originally?
Yeah, I've lived here my entire life. Yes.
Awesome.
The heat does not bother me. I would rather take the heat any day over a cold winter, any day. Yes. No, thank you. No, thank you. Cold winter, rain.
No.
I'm good.
I did my undergrad in Chicago. That was enough for me. I said, I got to get it. I'm never going back there.
Yeah. I actually have family in Chicago, and but I will live in Arizona probably forever, because I prefer the warmth. I don't like the cold. Okay. So with that, I definitely love the community aspect of that. And that's why I kind of resonated when your wife came in. I resonated with that because I love the community aspect. Pilates Tempe is a community. We've been in the community for so many years, and we really have built such a core group of amazing people. And I think when you reach out to people like that, and you're trying to help people and actually really care about the people that walk into your business. I mean, I know almost every single person that walks through my doors by name. And if I don't, it's because you may have just walked in the door and I haven't even met you yet. But I make it a point to know every person that walks through my doors, because to me, it's so important to create that relationship and to create that community and be a part of the community. So it's, you being new to the Valley and new to Tempe, I really think it's good that you're already reaching out and already trying to reach that goal and be a part of the community and help people. And I see that you definitely love what you do. I've following you on Instagram now, and so you can follow you on Instagram. I can't remember. It's just Dr. Ben Leong is your Instagram handle, and the website is Rehab Lab Arizona. So you can follow him and also go check him out on his website. Is there anything else that you want to leave our listeners with that you feel is important for them to know?
Well, I had a note or a thing that I wanted to say that I didn't say.
Okay.
That athleticism is, the way that I would define it, is versatile ownership of your body and of the space around you. And so one of my passions is to help people realize the athlete that's in them. And I know that you do this in your place too, where you have, we have all these things that we can do. But when you create ownership for yourself, right, that's when you really start to feel that healing that I was talking about earlier, that healing of, it's not just physical, but now I'm spiritually and mentally in a really good place because I own my body and I can own the environment. And I think that when people start to realize the limitations that I used to have, if I can kind of give those up and move on to a different way of defining my own terms, that's where people really start to unlock their healing. And so ultimately that's my passion, but that's what I would say. And listening to your podcast, that's kind of the energy that I was picking up on. So I wanted to kind of reconnect with that.
Yeah. I think people don't realize the power that they do have over themselves and over their own healing, not even just physically, but mentally and emotionally and financially, whatever it is. I don't think people realize the power that they actually have within them to change that and exude that and actually make a big change within themselves, because you really can completely do a 180. When I first started Pilates, before I owned the studio, before I even taught at the studio, I became a student. And I mean, I still worked out, I still exercised all the time, but I hadn't really, I guess, honed in on my personal craft for myself. I was teaching other people and doing, what I thought was the right thing, I guess, for myself and for other people, but it wasn't what I was passionate about. But when I first started training to do the certification for Pilates, I realized how inflexible I was. Even though I was a fascial stretch therapist and taught stretch classes, I realized how the lack of strength that I had, even though I worked out, 4 or 5 days a week, and I hike and I run and I exercise. And it's just taking that extra step or something that you need to change personally. Maybe it might not be for you, whatever it is, but for me, it was adding that extra thing, that extra Pilates into my routine that completely changed. My flexibility has changed. My strength is completely different. My body is different. And that's what I needed for me. So it's within you to create that change for sure. For sure. Yeah. Well, so Dr. Ben Leong, thank you so much for coming on the show. Please follow him on Instagram. Go visit him at Rehab Lab Arizona off of Southern and Kyrene. So you're just down the street from me. Thank you so much for coming on the show. I really do appreciate it.
Yeah, it was a ton of fun.
Yes. Thank you everyone for listening. I will have his information in the show notes. And when your online program is up and running, please let me know and I will post that as well. And I'll have that up for listeners to be able to log on to and get a hold of also. So yeah.
Sounds good.
Great.
Thank you so much, Gabby.
Yeah, you're very, very welcome. Well, thank you so much everyone for listening, and we will see you all next week.
Thank you so much for listening to the Fit Minute Podcast, Fitness for Real People, with your host, Gabrielle Mazar. If you would like more information on today's episode, you can find it in the show notes and on Gabrielle's website at www.destinationfitcations.com. Visit to keep an eye out for upcoming fitcations. Be sure to share the show, give this podcast a review, and subscribe so you won't miss an episode. Join us next week to hear more stories from people just like you. This has been the Fit Minute Podcast, Fitness for Real People with Gabrielle Mazar.